Welcome to another edition of IRG Physical and Hand Therapy's Health Talk. Shannon O'Kelly, Tom Huntler, glad to have you with us this morning. We have usually at this time we take some questions from listeners. In this case, though, we have a guest today, Shannon. It's Dr. Cynthia Warner. What are we going to hear from her?
Well, Tom, Dr. Cynthia Warner is a cardiologist at Providence Health Systems here in Everett, and we're going to talk about a cardiac series. We're going to do a little discussion on the need to make sure you're understanding your symptoms and don't sit at home with chest pain and have a heart attack. Get in and see the doctor. It is safe. So we're going to do a little cardiac series with Dr. Cynthia Warner.
All right, let's hear from Dr. Warner right now.
Dr. Warner, welcome to Health Talk. How are you doing?
I'm doing great, Shannon. Thanks for having me.
Thanks for joining us. You're a cardiologist, and I wanted to get you on the radio. I think it's important that we talk about the need to recognize certain signs and symptoms. Let's talk about what you're doing as a cardiologist to get these very important signs and symptoms of certain events looked at.
What we've found with the early data from COVID is that the incidence of hospitalizations and hospital admissions for critical cardiovascular diseases, as well as for most diagnoses across the board, have been decreased by as much as up to 40 to 50% during the pandemic. So I think it is really important to get the education and the awareness out that people should not wait in seeking help for.
Maybe you can kind of shed some light on certain cardinal signs you should not wait on.
Sure. So let's talk about heart attack, because it is the leading cause of death in the United States. Heart attack is a form of heart disease that has become critical, and it's based on the underlying process of atherosclerosis, which is fatty cholesterol deposits called plaques that build up on the walls of our heart arteries. And when they start to reach functional significance, limiting blood supply, and or when they become associated with blood clots, then that can keep blood from reaching your heart muscle, which then can become compromised. The longer the time that you wait between having symptoms and seeking help, the bigger the potential heart attack can be. Signs and symptoms that people should look out for are severe chest pain or pressure. Oftentimes, it will radiate or travel to their arm, their neck, their jaw, or their back. And it can often be associated with additional symptoms such as significant shortness of breath, nausea, feelings of heartburn or vomiting, and also feeling profuse sweatiness, cold and clammy skin, racing hearts or palpitations, and lightheadedness. Any or all of those symptoms are important to look out for.
How do you know that I don't have indigestion or something else going on? I mean, you described these very good, but I mean, I can imagine these people sitting at home going, "This is going to go away."
Yeah. Yeah. So obviously, if your symptoms are following a really large meal and you have a history of heartburn, then likely related to some what we call GERD or heartburn. But especially from a cardiac perspective, oftentimes these symptoms will be in association with when you are demanding more from your heart, when you are exerting yourself, when you're being active. Your heart arteries have to be able to respond with increased blood flow. However, it can't if there is significant blockages that are there that are limiting. Regular exercise or activity routine will often let you pick up symptoms earlier than you would if you're sedentary and not demanding more from your heart.
Dr. Warner, thank you so much for your information. The takeaway here is don't be afraid to reach out for medical help.
That's the bottom line. If you think you're having signs and symptoms of a heart attack, the hospital is the safest place for you to be.
All right, thanks to Dr. Cynthia Warner, where our next guest is Dr. Teresa Girolami. The difference between colds and flu and the COVID, she can help you differentiate. We'll have that coming up next on Como.